Namaste, this is Dr. Deepa from Sree Nandaka Fertility and Laparoscopy Center. So today our topic is IVF. How do you do it? So first you should know what are the indications for IVF. Like you know that whenever the woman ages more, when she's having low egg reserve or male factor infertility wherein the sperm count is low, and tubal factor infertility where the tubes have been blocked, or any like repeated IUI failures. They have tried for the couple has tried the fertility treatment for many years. Even the smaller treatments like IUI they have started, but still they have planned, but still they didn't conceive. Then those patients, and even unexplained infertility, they go for IVF. In IVF, what we do? IVF is nothing but the duration of IVF is usually 1 month. Like we start from day 2 of the woman period. This is the fallopian tubes. Now, these tubes have its own importance. Like the sperm and the egg, they meet in this tube to form an embryo. The process which takes place in the fallopian tubes takes place in the test tube. This is what we do in the lab. That is the reason we call it as a test tube baby. So in IVF, what actually we do? What we do is we stimulate these are the ovaries. So we stimulate the ovaries by giving injections. By giving injections, we try to increase the size of the follicles. Ovaries has follicle. Each follicle will have 1 egg. So when we give injections, we will be stimulating the ovaries to produce more number of follicles. So this stimulation phase goes around 10 to 12 days. So every day the patient will come for injections, then this goes to up till 10 to 12 days. By 12 days, once the follicle size has reached 20 mm, then we give a trigger injection. That is for the maturation of the egg, and that after giving the injection we pick up the eggs exactly 34 to 36 hours. Then how do you pick up the eggs? We pick up the eggs by giving anesthesia to the patient and through vaginal route only. Through vaginal route we just take the eggs, and this is a painless thing. And now here this completes 1/2 of the IVF. Another half happens in the lab. What happens is that once we pick up the eggs, we take the sample from the husband, and we try to fertilize the egg with the sperm of the patient husband, and try to grow the embryos for 3 to 5 days. And this again in IVF, what we do is we do 2 types of transfers. One is fresh embryo transfer, another is frozen embryo transfer. Once we grow the embryos for 3 to 5 days, we transfer back the embryos into the womb of the patient, and that is called fresh embryo transfer in the same cycle. Another one is called frozen embryo transfer, wherein once we grow the embryos for 3 to 5 days, we freeze the embryos either in day 3 stage or in day 5 stage. And later, when the patient recovers from this IVF stimulation, we transfer the embryo after a gap of 1 or 2 months. That's called frozen embryo transfer. What is the advantage? For which patients you do fresh embryo transfer? Fresh embryo transfer usually we do for patients in whom we have retrieved a very less number of eggs, like around less than 7 eggs. In that case, we go for fresh embryo transfer. Whereas if the number of eggs we have collected from the patient are more than 7 or 8, we do not go for fresh embryo transfer, because that is not good for the mother, to the woman. That is because of these high hormones, she may have complications or side effects of this IVF. So in that case, we freeze the embryos, we'll give time for the woman to heal, and then after a gap of 1 or 2 months, we again deposit the embryos into the womb. Then how do you do that? This frozen embryo transfer again starts from the day 2 of the cycle. When the patient comes, we had just put her on some estrogen pill for the development of the endometrial lining. This endometrial lining takes about 10 to 12 days. So if she comes for scan again on 9th day or 10th day, wherein we check the endometrial lining, and the endometrial lining we expect it to be around 9 to 10 mm. And at that stage, we transfer the embryo back. Now, they have 2 transfers. We do day 3 transfer and day 5 transfer. Day 3 transfer, when we do, we test the urine pregnancy test, or we wait for at least 12 to 14 days. And whereas if you go for day 5 transfer, we wait for 10 days for the result, whether she has conceived or not, to find out. The success rate of IVF, when you come back to success rate of IVF, it depends upon the age of the woman, because age of the woman, as if she is less than 32 years, the success rate is around 50 to 60%. If she is more than 32, like 32 to 38 years of age, it is 30 to 40%. And if she is more than 40 years of age, it is less than 20%. Apart from that, it also depends upon the male factor, like the sperm morphology, and also the endometrial lining, and the embryo quality and the egg quality. So try to be open and transparent with your doctor so that they can guide you and counsel you correctly. Any doubts regarding IVF, you can comment below, and please subscribe to my channel.